Hello, and welcome to Enhancing Awareness of Concussion, Symptoms and Support Strategies. This is a series of presentations and informational videos from Canadian organizations and researchers created for Concussion Awareness Week and the concussion community. We encourage you to pause this video as needed, use the transcripts to read along, or use the bookmarks below to navigate to different parts of the video. We also encourage you to visit the websites of our partners linked below to learn more about concussion and access resources. Thank you and enjoy the presentations.
My name is Michelle McDonald, and I am the Chief Executive Officer of Brain Injury Canada. We are a national charity focused on the areas of education, advocacy, awareness, and community-based research. Concussion Awareness Week is an important time dedicated to raising awareness about the impact of concussions and promoting strategies for prevention, recognition, and management. This week highlights the need for education on the signs and symptoms of concussions, the importance of proper medical evaluation, and the critical role of recovery in preventing long-term effects. Concussions are complex and can affect every facet of a person's life, making continuous awareness and education crucial year-round. Brain Injury Canada, along with its partners across the country, have been actively advocating for Bill C-277, an act to establish a national strategy on brain injuries. In June, the House of Commons voted unanimously in support of this important bill, which has been now moved to the Health Committee for review. While there are still some legislative steps ahead, we are dedicated to advancing this initiative and ensuring comprehensive support for brain injury awareness, prevention, and treatment over the long term. The goal of Bill C-27 aims to improve the health of all people living with brain injury by making sure all provinces and territories work together more effectively, reduce the differences in healthcare quality and equity across Canada, make it easier for Canadians to access care in a timely manner, and improve the collection of standardized data on how common brain injuries are and the impact over the lifespan, so policies and resources can be better directed to where they are needed most. And to ensure the Minister of Health is responsible for reporting on the details of this legislation every year. If you want to get involved, please visit www.braininjurycanada.ca to find out more information about Bill C-277. Our website, available in both French and English, also has an extensive resource section for both individuals with brain injury and family caregivers, so take some time to visit and have a look around. Thank you and enjoy the presentations from our partners.
Hi, my name is Noah Silverberg, and I'm going to be talking to you today about concussion and mental health. So just want to share a few key pieces of information on this topic. The first being that how people think about and cope with their symptoms following injury can make an important difference in how well and how quickly they recover. I'm just going to walk you through one example of a way of coping, fear avoidance behavior. And we're familiar with how that might play out in the context of being afraid of dogs. So it starts with some kind of stimulus in the environment that we find aversive and try to stay away from it, which at least temporarily makes us feel better, and so motivates more avoidance behavior. Now, over the long run, that can have consequences. In the case of avoiding dogs, it will make it so you continue to be afraid of dogs. And also, maybe hesitant to go any place where you might encounter a dog and so on. So it can be kind of restrictive for your life in important ways. We see a similar kind of situation sometimes playing out after concussion, where people find that exerting themselves or lights, noise, movement is aversive or bothersome, so they try to stay away from activities and situations where they might encounter those things, which again, in the short term can make it so they have fewer flare-ups in their symptoms, but in the long term can hinder recovery, where people are more sensitive to situations that might bring on their symptoms and so on. So that's one example of how coping can be unhelpful following concussion. We also know that mental health problems like depression and anxiety are very common after a concussion, more so than in the general population, and also people who have a physical injury to elsewhere in their body. And we know that something like 1 in 3 people following concussion within the first 6 months or so will experience problems with depression or anxiety. We also know that when present, mental health problems can make concussion symptoms worse. So, for example, somebody who has depression and is still recovering from a concussion will tend to have more symptoms than somebody with concussion only. So I'm referring to here to what we call post-concussion symptoms, such as sleep and problems with sleep, fatigue, difficulty concentrating, and so on, which of course are not unique to concussion. They also occur with depression and stress. And so that's one obvious reason why the combination of concussion and mental health problems tends to lead to more of these kinds of symptoms. So stress may amplify symptoms that are already there from a concussion, or may even create new symptoms that are attributed to concussion or thought of as concussion symptoms, but actually are symptoms of anxiety or depression. So the sort of explanation at the top, I think, is an intuitive one. It's what many people believe, that mental health problems are caused by concussion symptoms. So people have these symptoms, they're bothersome, and they get anxious and maybe depressed about their situation. And what the research tells us is a bit of a more complicated story, in that what I just said is probably true, but the direction goes the other way as well, as I was describing how mental health problems can contribute to concussion symptoms, perhaps even more so than the vice versa situation. So that what I've described so far is kind of mostly bad news. On to some better news is that healthcare professionals can pretty quickly screen for mental health problems. There are really helpful short kinds of questionnaires. This is one example, screening for depression, that just takes a couple minutes, where patients are asked to rate how often they've been feeling these different ways. This is another example of a screen for post-traumatic stress disorder. So the kinds of things that can be done, in the waiting room or online before a doctor visit, that kind of thing. Some more good news: mental health problems are treatable. Treatable in much the same way that we treat mental health problems occurring in the absence of a recent concussion, and that's generally with certain kinds of talk therapies that have been proven effective in research studies, such as cognitive behavioral therapy and medications like antidepressant medications. So just lastly, to highlight a few things that a patient can do to help with their recovery. One thing is to stay engaged. So even if you don't feel much like doing things, concerned that it might make your symptoms a bit worse, it's important to stay connected with activities and with people that you value. Those that will actually be good for your recovery. Stay connected to social support, any kinds of heart healthy activities. That includes, diet, exercise, and so forth, will also be good for brain health in general and mental health. Also very important to avoid alcohol and drugs as a way to manage stress, and recognize that if you are drinking or using drugs as a way to feel less emotional pain or stress, that there are definitely going to be healthier ways of doing that. And lastly, if you're struggling and unsure about where to go, to be sure that you reach out for help.
Hello, my name is Keith Yates. I'm a professor at the University of Calgary, where I co-lead the university's Integrated Concussion Research Program. Today, I'd like to tell you about the Canadian Concussion Network. I have the honor of being the inaugural chair of the CCN, as we like to call it, which was established in 2020 with funding from the Canadian Institutes of Health Research. The CCN seeks to establish and guide a coordinated research and knowledge translation agenda that will reduce the risks of concussions and their consequences. We bring together researchers, trainees, and a wide range of multi-sectoral community partners to try to solve the global challenge of concussion. The CCN currently has over 400 members and 40 partner organizations that include health service agencies, educators, a variety of nonprofits, healthcare providers, and government. Our members span all provinces. About half of our members are trainees, so we're truly invested in preparing the next generation of concussion researchers and clinicians. The CCN engages in a wide variety of activities intended to promote research, training, knowledge translation, and commercialization. The most visible of these are our annual meetings, which typically attract around 200 attendees and give our members and partners a chance to share their research and knowledge translation efforts, build new collaborations, and just get to know each other. We held our 4th meeting in Ottawa this past May. I encourage you to consider attending our next annual meeting, which will be held June 9 to 10th, 2025 in beautiful Victoria, British Columbia. In addition to our annual meeting, we also offer pre-conference virtual panels, hold public events with partners, publish meeting abstracts, facilitate training through webinars, speakers, and trainees social at the annual meeting, as well as a mentorship program and visiting trainee program. We offer support for research grants. We raise awareness and support knowledge translation through programs like the Concussion Priority Setting Partnership, and we continue to build and expand on our community partnerships. What does the future hold for CCN? We will be establishing a research portal on our website where researchers can post research opportunities for the public. We're also working on a position paper that lays out a national research and knowledge translation agenda based on surveys of our members and partners, as well as what we know the public views as major priorities. To learn more about the CCN, please visit our website, www.ccn-rcc.ca. We have both English and French versions available. Thank you.
Hi, my name is Spencer Cho. I'm a member of the Transcendent Concussion Community Advisory Committee and created this presentation to touch on the importance of patient perspectives and my own lived experience with concussion. To give a brief introduction, currently I'm a 3rd-year medical student at the University of Ottawa. Previously, I completed my Bachelor of Science degree in kinesiology at Western University. Growing up my whole life, I loved to play all different sports such as soccer, golf, basketball, but most notably snowboarding. I started snowboarding when I was 8 years old, and then I started competing in freestyle snowboarding when I was about 12. Through snowboarding, I was able to travel across the best resorts in North America, train with Olympians and several members of the Canadian national team, and compete in several national and international competitions. During that time in my life, everything revolved around me competing, and it was a huge part of my identity. Moving on to my concussion story, I was competing at Canadian Nationals in the spring of 2016. At the time, the weather was very warm, so the snow had become very soft and slushy, decreasing the ability to gain speed to go over these very large 50 to 60 foot jumps. Thus, throughout practice, I got in the habit of going straight down the hill to get enough speed. During the competition, in my first run, similar to how I practiced, I set off down the hill, bombing straight towards the jump. However, I wasn't aware that in between the practice and competition, they had salted the takeoffs of the jumps, which acts as a speed boost. I had way too much speed going towards the jump. I went beyond the landing, around 80 feet to my back. I remember being really high in the air, having completed my rotation, and slamming my head and becoming really dizzy after. It wasn't until I got back on the chairlift, going back up the hill, when I realized my helmet had split into 2 pieces. From this injury, I suffered a lot of the common concussion symptoms such as headaches, feeling foggy, exercise intolerance, and dizziness. This was the most challenging injury of my career because I felt like I wasn't exactly myself in the periods after. This was a huge wake-up call, and it really made me consider my future going forward, whether it was worth the risk to my brain health. I ended up choosing to go to university, and although at the time it was very difficult to give up competing in sport, as it was a huge part of my identity, I feel that this experience really helped to shape who I am, and I feel the passion to get involved in concussion care. Especially now as a medical student, I've been able to get involved as a patient partner and researcher to better concussion research for patients such as myself. I feel patients should feel empowered to leverage their experience to help others who may experience something similar, researchers to improve outreach and answer questions important to patients, and clinicians to help tailor to these populations. Thank you for listening to my presentation.
My name is Ruth Wilcock, and I'm the CEO of the Ontario Brain Injury Association. Concussions happen in an instant, and they do not discriminate. They affect people of all ages, ethnicities, and genders. The stats around concussion in Canada are staggering, but we must remember that behind each statistic is a real person whose life has been turned upside down. At Obaya, we have received literally thousands of calls from people who have sustained concussions. Many have gone years without a diagnosis, living in a state of unknowing. Despite increased media coverage in recent years, the seriousness of concussions are often still misunderstood. This lack of awareness can lead to stigma, and this is something we are committed to changing. While the majority of people recover from their concussion, many don't. And it's frustrating, and rightfully so. Many of our members have experienced delayed diagnosis, long-term symptoms, and difficulties accessing the care that they need. What we hear so often is that beyond the physical symptoms, the emotional toll is profound. Anxiety, depression, and isolation are common. Many feel like their concerns aren't being taken seriously, even sometimes by family and friends. We often hear about the struggles of returning to work, which simply adds to the emotional and financial strain. At Obaya, our role is to ensure that we continue to support those affected by brain injuries, including concussions, through education, awareness, and support. We understand that those who sustain concussions often feel like they have mountains to climb, but within each person's story is incredible strength, resilience, and fortitude. Collaboration across sectors and greater awareness are essential to helping individuals navigate their recovery journey. Brain injury associations across Ontario and Canada play a pivotal role, and together we are committed to ensuring that no one walks this path alone.
Hi there, my name is Catherine Schneider. I'm a physiotherapist and a researcher at the Sport Injury Prevention Research Center and at the Concussion Rehab Lab at the University of Calgary in Calgary, Alberta. I'm pleased to share with you today this presentation talking about dizziness following concussion. So, what do we know about dizziness and what do we know about balance? If you think about what we know about the different systems that help you stay balanced, you get input from your eyes, your inner ears, and then all the muscles, ligaments, and joints of your body, many of which come from your upper neck. And this is all processed by your brain to then have output that helps keep you maintaining an upright position in space. Dizziness is a type of sensation where you feel perhaps unsteady, off balance, and dizziness is a catch-all term that captures a number of different types of sensations. So you might feel lightheaded, a sensation of vertigo, which could be a sensation of spinning or shifting around you when you know that objects are not in motion, unsteadiness, could feel like a tilting or tipping motion, oscillopsia, where you see objects move, but you know they are stationary, fogginess, or feeling faint. Symptoms of dizziness can last for a variety of different durations, and depending on the cause, will have different duration of symptoms. They might last for seconds, minutes, hours, or days. And understanding the duration of your symptoms can help your healthcare professional figure out what might be causing your dizziness. You may have associated symptoms that come along with your dizziness as well, such as headache, neck pain, sensitivity to light or noise, or other symptoms. Dizziness has been reported to be associated with disability, can be associated with depression, decreased social activity, and self-health ratings, and an increased risk of falls. which is not surprising since you would have difficulty figuring out where you are in space. Dizziness is very common and typically the second most commonly occurring symptom following mild traumatic brain injury and concussion. It's been reported to account for 10% of all visits to family physicians and occurs at any point in time in 20 to 30% of people and in 40 to 80% of individuals that have sustained a motor vehicle collision. And in many cases, dizziness may persist. And some of the research shows, again, 40 to 80% of individuals may have persisting dizziness. So, what might be an underlying cause or source of dizziness? The vestibular system or inner ear, migraines, you could have a vestibular migraine, the cervical spine or neck, central nervous system. It's the second most common side effect of medications. It could be due to other reasons related to psychological challenges. However, in many cases, anxiety and depression actually accompany dizziness, again, which isn't surprising given how disconcerting this sensation can be. It can be due to vascular problems or other. And in many cases, there may not just be one source, but more than one source. So sometimes it's a bit of a tricky symptom for your healthcare professional to figure out. There are a number of different types of dizziness that have been reported following mild traumatic brain injury, including a unilateral peripheral vestibular hypofunction, benign paroxysmal positional vertigo, cervicogenic dizziness or neck-related dizziness, central vestibular dizziness, which is related to the brain processing vestibular information, vestibular migraine, and persistent postural perceptual dizziness, and others. I'm going to go through just a couple of these with some examples for you. It's really important, though, to have the appropriate diagnosis to then direct management accordingly, as different types of dizziness require different types of treatment. This is a picture of your peripheral vestibular labyrinth. On the right-hand side, inside of the red circle, is a picture of your 3 semicircular canals. And these canals sit in different planes of motion, so they sense movement in different directions. They're filled with a fluid, and at the end, there's a bundle of hairs. So when you move, the fluid moves and tips the hairs one direction or the other to send off a signal to the brain to tell the brain which way you're moving. As soon as you're done moving, the fluid movement stops and the brain knows you've stopped moving. Inside this yellow circle is a chamber-like structure called your otolith, which helps the brain sense tilting and tipping movements. In here, there's a bundle of calcium carbonate crystals that sit on top of hair cells encased in a gel. And so when you tilt one way or the other, the weight of that crystals shifts and sends a stimulus off to the brain to tell the brain that you're tipping. And that's how you sense tilting and tipping motions. The vestibulo-ocular reflex is a reflex that helps your eyes see clearly when you move quickly. So most people are pretty familiar with the reflexes between your inner ear and the muscles and ligament muscles of your body that help keep you upright in space. But another important role of the vestibular system is to help keep your eyes fixed on a target when your head moves in space. So it keeps your eyes moving at the same speed as your head, but in an equal and opposite direction, so you can see clearly when your head moves. At lower speeds, you can use other systems, but once you start moving quickly, only the vestibulo-ocular reflex can keep those eyes stable on a target so that you can see clearly. So if you look at the screen and you turn your head side to side and you go a bit faster and faster, the faster you go, the harder it might be to see clearly when you're turning your head. That's your vestibulo-ocular reflex working to keep the target in focus. Normally, both your right and left inner ear would give the brain the same input about where you are in space. So it would be equal. In some cases, however, one ear doesn't sense motion as well as the other. And then that input coming into the brain is not equal. And people may feel dizzy. This is what's believed to happen in some cases, approximately 10% of individuals that have dizziness following mild traumatic brain injury or concussion. Another common problem is something called benign paroxysmal positional vertigo, where the crystals from that chamber-like structure, your otolith, are believed to get dislodged into one of the canals. Then these crystals move more slowly than the fluid does. And even after you're done moving, the crystals then take a bit of time to get to the lowest or the most dependent part of the ear, causing a resulting vertigo and some eye movement with changes in position. In this case, dizziness will last for seconds and you will have spinning with changes in position. Here's an example of a video of someone that has benign paroxysmal positional vertigo, or BPPV, sometimes commonly called the crystal problem. And what you can see here is the eye moving in a specific pattern that matches the test position. And at the time that the eye movement is going, the patient feels a sensation of spinning. Then as those crystals settle down to the lowest part of the canal, the eye movement stops, and so does the sensation of spinning. This is a type of dizziness and vertigo that can be treated very successfully with canalith repositioning maneuvers, and seeing a vestibular physiotherapist can help to identify which canal this is in and treat this appropriately. Make note, though, that it should be treated successfully within 1 to 3 treatments. The neck can also be a source of dizziness. The neck can give you neck pain, neck-related headaches, and neck-related dizziness. There's lots of different sources of pain and problems from the neck, but in the case of dizziness, we also know that the neck gives the brain a wealth of input about where you are in space. And it's this proprioceptive input from the neck, when it's altered, that's believed to result in dizziness, secondary to the cervical spine. In this case, neck pain tends to increase with neck-related dizziness and decrease neck pain with decreased neck-related dizziness. It is also possible to have cervical spine involvement and concussion concurrently, because the head does sit on top of the neck. So just because the neck is involved doesn't mean that you don't have a concussion. I thought it was also important to just mention headaches here. Headaches are the most common symptom consistently reported following concussion and mild traumatic brain injury. In some cases, individuals may have pre-existing headaches that get worse or last longer. And in some cases, headaches can begin following a trauma, but they must occur within 7 days of trauma, according to the International Classification of Headache Disorders. Similar to dizziness, there's a number of different headaches that can present following concussion, and it's really important, again, for appropriate diagnosis to then direct management accordingly. This is a complicated diagram. However, what I have it here for is to just represent the many different areas that can be affected following concussion. And from a dizziness standpoint, there's a number of different systems that should be evaluated to then determine which treatment might be appropriate. A number of different healthcare professionals may be involved in your treatment, and depending on the type of dizziness, different healthcare professionals will help in different ways. From a treatment standpoint, the updated recommendations from the Amsterdam Consensus include an initial period of relative rest for 24 to 48 hours, followed by light physical and cognitive activity while limiting screen time. Mild symptom exacerbation of 1 to 2 points on a 10-point scale is okay, provided it resolves within 1 hour. If symptoms are greater than 2 out of 10, one should decrease the amount of activity that's being done until you get below that 2-point threshold. There's also strong research to support the use of aerobic exercise as a treatment, starting as early as 2 days post-injury, but this should be individualized to the athlete. The evidence also supports the use of cervicovestibular rehabilitation, which is a combination of treating the neck and the balance systems in individuals that have headaches, neck pain, dizziness, or balance problems, starting as early as 5 to 10 days post-injury. There's also some research that collaborative care and active rehabilitation may be of benefit, and this should all be done in combination with the symptom-tolerated aerobic exercise. This is just a schematic of our cervicovestibular rehabilitation trial that we did, where we compared individual treatments for the neck and the balance system for individuals that had persisting symptoms following concussion. And what we found was that the individuals that we treated with the individualized treatment were 10.27 times more likely to be medically cleared to return to sport within an 8-week time period, compared to the people that just continued to rest and follow a gradual exercise progression. In summary, dizziness can occur for a number of different reasons, and following up with your healthcare professional to figure out the underlying cause for your dizziness can help you seek the most appropriate treatment to help facilitate recovery. The assessment will help direct the specific treatment, and there is evidence for exercise as well as cervicovestibular rehabilitation, and engagement of interdisciplinary teams of healthcare professionals can be important depending on the involvement of different systems. So I'd just like to say thank you so much for your time and for listening to this presentation today. And please reach out if you do have any questions.
Hi, my name is Stephanie Cowell, and I'm Director of Knowledge Translation at Parachute. We're Canada's national charity dedicated to preventing serious and fatal injuries. And we want to see everyone in Canada have the opportunity to live a long life to the fullest. In injury prevention, our priority focus areas are leading causes of injuries, including concussions and traumatic brain injury. These are incidents like falls and motor vehicle collisions. We also do focused work in the area of concussions. Concussions are the most common form of traumatic brain injury in Canada, and they're an important focus for prevention. We can prevent many concussions from happening in the first place, but we could also focus on helping people when a concussion does happen. The work that we do takes on a few different roles. We bring people together from across Canada, we develop resources, and we support policies that will help advance prevention, education, and better care for people with concussion. You can check out our website to find all sorts of free resources available in both official languages. You'll find information on concussion that will answer key questions people have. Whether you're a parent or a caregiver, an adult thinking about return to work, or a teacher or a coach playing a role working with young people who may sustain a concussion. We also have return to activity guides for all sorts of activities, including work, learning, and return to sport and physical activity. Visit parachute.ca/concussion for more information.
Hello, my name is Roger Zemek. I'm a pediatric emergency physician, senior scientist, and concussion researcher, and I have the privilege of leading the Transcendent Concussion Research Program, as well as I'm the co-lead for the Living Guidelines for Pediatric Concussion Care, and I'm going to be talking about tips on how to manage acute and persisting concussion symptoms based on the best evidence, as well as an insight into future of concussion research. One of the most common questions we are asked when people present to the pediatric emergency department is how long will people get better following a concussion? The short answer is concussion recovery is different from every person because this is an injury of the most complex organ in the body. We do know that most people do recover quickly. Almost 70% will be recovered within 1 month, and interestingly enough, the younger the child, the faster they even recover. One of the things that we do in the emergency department and at concussion clinics is try to predict how long someone will be to recover and determine who is at higher risk of recovering more than a month. Those are things that we use called clinical prediction rules, and we'll be talking a little bit later about the 5P prediction score and who should be referred to be targeted for earlier treatment. Earlier treatment should be at an interdisciplinary team, including physicians or nurse practitioners and other clinicians across all disciplines working together to assess, diagnose, and treat patients to get them back doing the things they want, love, and need to do as quickly and as safely as possible. So briefly, can we predict how long symptoms last after concussion? The study that we led through the Pediatric Emergency Research Canada network was called the 5P study. That stands for Predicting, Persisting, Post-Concussive Problems in Pediatrics. And the goal of this study was to derive a clinical prediction rule of those persisting symptoms using clinically available factors in children who presented to the emergency department after a concussion. We recruited over 3,000 patients presenting within the first few hours of injuries to 9 emergency departments across Canada. And what we found was that we were able to generate a clinical risk score for pediatric concussion for those people whose symptoms were lasting more than 1 month. What were those signs and symptoms? It based on all different factors, and if you're curious, you can go to the living guidelines and go over what those prediction rules were. In short, they factor into past history, demographics, early cognitive functioning, balance assessment, early signs and symptoms. It's an easy score that can be applied, and I will put the links in for the guidelines later on in this talk. So let's say the physician, though, diagnoses a concussion. In the past, patients were told to rest and not do anything, school, physical activity, until they were symptom-free. Many people would interpret this as home jail, and people would avoid school and avoid going even for basic, low-risk, low heart rate physical activities. We now know we can do better. So how do we manage, and how should we manage, concussion based on the best evidence that's been established in the living guidelines for pediatric concussion? So the first question is, should people rest until they're completely symptom-free after concussion? And the short answer is no. Returning to safe physical activities is important for helping people optimize their recovery and get better faster. There is very good evidence to establish that exercise is medicine for concussion. It improves the blood flow to the brain, bringing to the brain many of the important key nutrients for recovery, as well as releasing as important recovery factors such as BDNF, which is a chemical only released in exercise. Better exercise can improve mood through the release of endorphins, improve sleep, which also benefits recovery, as well as helping to get the person back on track to treat some of the other symptoms that may be associated with concussion, including things like autonomic dysregulation or dysfunction, the treatment of which also is exercise. So in short, exercise is medicine for concussion. This is a phrase coined by Dr. John Leddy, pictured here on the left, who even wrote an article entitled exactly that. Our team, looking at the 5P data set, also looked at exercise early and determination of how many people had ongoing symptoms with concussion following their injury. And we were one of the first teams to find that the sooner people started returning to exercise, even when controlling for how symptomatic they were, the earlier they started exercising, the faster the association of the recovery went. This study was also published in JAMA, and there is the QR code here if you want to learn more. Dr. Leddy, who I just had a photo of in the earlier slides, also did a study randomizing people to a stretching and yoga type exercise versus a observed subsymptom exercise based on heart rate. If you think about this, it's basically a stress test for the brain, similar to how someone would have a treadmill or bike test following a stress test for chest pain or something like that in an older person. And what Dr. Leddy and his team found was that those who were able to do a targeted, tailored heart rate increase in the setting of an observed clinic with medical supervision, the athletes that did early physical activity using this sub-symptom threshold did recover faster than those in the other control group. Again, through the Pediatric Emergency Research Canada network, we also did another study in which patients self-progressed on their physical activity, starting with walking and grading their own exercise in a safe manner. This study randomized children to a home progression exercise versus the progression only when they were symptom-free between steps. And for those children who complied with the protocol, they also got better faster and just as safely as those who had done it waiting until they were purely symptom-free to progress. Furthermore, kids who were doing those protocols were much faster getting back and getting cleared from their physical activities to do the things they want to love and need to do. So to summarize, it's important to rest, perhaps for the first day or two following the injury, but after day 2, resting beyond that may actually slow recovery and is no longer recommended. Having a supervised low-risk exercise, such as the Buffalo bike treadmill or the Buffalo concussion protocol based on a medical supervision, even as early as 1 to 2 days following the injury, has been shown to improve recovery. It's okay when people get back to doing physical activity if the symptoms are exacerbated mildly. That does not cause brain damage. What we also, though, want to reiterate is this is not clearance to return to high-risk, full contact or competitions or even practices. The next question that's commonly asked by people when they present to the emergency department or to clinic is, when can kids go back to work or school? Returning to school and work should begin as soon as possible, ideally within a matter of days. This does not mean you need to go back to your full course load with exams and lots of homework and making up for missed time. Getting back, even with some accommodations, are really important. Things like accommodations may include reduced homework, waiver of missed work already, more time to complete some of the assignments, and then things to tailor based on individual symptoms. These things may be things like larger fonts, less screen times, and short breaks. We studied this early return to school, again using the 5P cohort, and we found that kids who got back to school earlier also recovered faster from their injury. These are now part of the guidelines as well. So to summarize, returning to school is beneficial, and it's okay if students have some symptoms when they are returning. Missing more than a week of school can actually be harmful. Again, when kids are going back to school, it does not mean they do higher risk activities such as contact or collision sports in gym or recess time. So those things need to be cleared by their doctor before children are approved to go to that stage of their stepwise progression. However, it is also really important that for those first few days after the injury, kids do not need a note from a doctor just to go back for short periods of time. Next, let's talk about who needs to be seen and why having an interdisciplinary team may help people get back to activities safer and faster. So this is based on evidence done out of the group out of Pittsburgh that is now part of the guidelines, that's showing people getting into an interdisciplinary clinic within the first week of injury do better than those who are seen at 2 weeks and beyond. So who should be referred? Anyone who is developing, based on their clinical prediction 5P score, a higher risk of persisting symptoms should be referred as soon as possible to an interdisciplinary clinic. Those youth who have not already shown signs of improving after 2 to 4 weeks, meaning that their symptoms are the same or even worse, or only with minimal improvement, should be referred for additional interdisciplinary care. Athletes wishing to be tested on the subsymptom exercise in a supervised manner on either a bike or treadmill would benefit from going to an interdisciplinary clinic with that opportunity. And finally, if a youth is directly injured, there are some clinics that will even see patients if they have been injured and don't have a primary care doctor by a self-refer. This is something to be discussed and determined in your local region. If someone is referred to an interdisciplinary clinic, how are they treated? Well, again, if seen in the first couple days of injury, youth are told to make sure that they have that initial day or two of rest. And then the first steps are gradual return to physical activities, namely reintegration into school part-time as tolerated, with quickly increasing with accommodations. And then also in parallel, increasing and safe, low-risk physical activity. and increasing as tolerated and as per the medical clearance in a stepwise manner with medical supervision. Furthermore, clinics that are interdisciplinary may also have additional treatment options. Some of these may include occupational therapy, which would support gradual return to school, work, and life. Physiotherapy, which would treat things like neck pain, dizziness, balance, and visual problems. Exercise rehab can be a supervised bike test or treadmill test or a tailored exercise plan to improve brain recovery as a way to more quickly improve symptoms. Some clinics and some patients may require mental health counseling. Those are to give kids the tools when negative thoughts or lower mood arises as a way to treat this and prevent this. Some clinics may also offer neuropsychology, which are ways to check for reaction time and brain processing speed, and to offer treatments as needed. And then finally, physicians can prescribe medications. Those are things to treat headache, sleep disorders, or mood symptoms. It is common, especially upon the return to school time of year, when people ask about what about screen devices. The best evidence that's currently in the guidelines do recommend avoiding screens for the first 1 to 2 days. Yet, at the same time, youth can gradually resume these devices if the symptoms are tolerated. However, we recognize a lot of schoolwork is done on computer and or tablet or laptop, and therefore some youth who are having challenges looking at screens may require additional accommodations to not prevent them from getting back to school. Like most things in concussion recovery, the Goldilocks approach, not too little, not too much, is often the best approach. The last tip I want to talk about is mental health. We have demonstrated in a large study looking across the population of Ontario that youth who have had concussions are at much higher risk of subsequent mental health problems compared to those who presented to emergency with an orthopedic injury, such as a sprain or a minor fracture. Emotional changes are very common in concussion. They can be exacerbating pre-existing conditions or even the development of new worries or new sadness. Treatments for mental health may include mindfulness, exercise, speaking with a counselor, or even medications. Therefore, it's really important to screen for and identify and treat youth with ongoing or worsening emotional symptoms to prevent any of these long-term problems. Finally, the ultimate way to treat a concussion once it occurs is with precision medicine. The ultimate dream is to provide the right treatment for the right patient at the right time. One of the exciting things we are doing across Canada is the Transcendence Study. The Transcendence Study is a study funded by the Ontario Brain Institute, which will help us bring in thousands of participants with millions of data points to help us determine how we can better predict, monitor, treat, and determine recovery for patients with concussion. In order to determine the best way to address this, we will be looking at factors like autonomic dysregulation, using a tilt table, looking at novel ways of objectively measuring their eye function using a thing called an eye tracker. We will be incorporating advanced MRI scanning, as well as using blood and salivary biomarkers to better detect and monitor disease. And we'll be working with industry to come up with novel treatments, such as even an app for mindfulness to help youth and improve accessibility for youth who may not have a mental health provider or a clinic near them, and something they can treat on their own. If you wish to learn more about the guidelines, the Transcendent program, or some of the handouts for patients and youth who've had a concussion, please see the QR codes listed here on the screen. Thank you very much, and it is a pleasure talking to you. If you have further questions about the concussion program, you can email. There's a link on the Transcendent webpage to submit your questions. Thank you very much.
Hi, my name is Jenny Dawson, and I am a research associate at the CHEO Research Institute in Ottawa. along with Dr. Roger Zemek from CHEO and Dr. Nick Reed from the University of Toronto, we organize and develop the Living Guideline for Pediatric Concussion. Project team also includes 48 other concussion experts from Canada and the US. Together, we consider the latest evidence-based advances in concussion care and maintain over 80 clinical guideline recommendations that are shared in both English and French on our website. Our goal is to ensure that every Canadian healthcare professional has access to the most up-to-date concussion protocols. We also work with the Transcendent Concussion Research Community and Patient Advisory Committee that's funded by the Ontario Brain Institute to help ensure that information shared in the guideline reaches those that need it most. Finally, we've just launched an update to 4 of our concussion resources on the website. These are targeted resources that share the clinical recommendations in a way that will be useful for teachers, coaches, patients, and also parents. I encourage you to check out the website. You can access it at PedsConcussion.com or by scanning this QR code. We look forward to continuing to work with our many partners at the Canadian Concussion Network to ensure that all Canadians have access to evidence-based and updated guidance for preventing concussions and, if diagnosed with a concussion, all the information you need to safely return to the activities you enjoy.
Thank you for watching our Concussion Awareness Week presentation series. You can use the links in the video description to learn more about concussion, visit the websites of our partners, and access available resources.